Hey everyone, it's Dr. Marshall and Dr. Ann with PhysioU, and today for the Mentoring Minute we'll be talking about neck pain related to mobility deficits. First we'll talk a little about the assessment when we talk about mobility deficits. And there's a systematic review that looked at 36 different articles looking at range of motion. What they came out with is really there's some conflicting evidence about the prognosis of it in general, but overall they found a negative relationship to limited range of motion and a positive outcome with improved range of motion. So that being said, let's just look at cervical range of motion. The biggest limitation they found was in the rotational directions as that prognostic. So go ahead and turn to your left. We can measure with a goni, right? And then turn to the right. Besides just active range, we want to do overpressures and passive range. So if she looks towards me, it's important to make sure that you block the scapula with your elbow and forearm, so that way as you overpress, their body just doesn't start to turn. So as I block your scapula, one hand here, one in here. All right, I'm looking for that end feel. Take it to that end feel. If I go a little bit past it, looking for stiffness, asking about pain, then comparing to the other side. When it comes for treatment for mobility deficits of the neck, there's lots of evidence suggesting thoracic manipulations as a beneficial outcome for neck pain. So if you go ahead and lie on your stomach, so there's one systematic review that looked at 5 different randomized control studies, over 300 participants, subjects with neck pain, that found benefit from thoracic manipulations. Right? What they did in the study was they found stiffest level. Go ahead and put your arms by your side, please. They found the stiffest level, right? And then wind up the tissue with one hand, wind up the tissue with the other hand. Deep breath in, breathe out, sink in. A quick grade 5. However, in another study that compared prone manipulation for extension versus go ahead and lie supine versus supine for the flexion manip, they found that regardless of which category you went into, so they blinded the therapists and subjects, and half of them got manipulations that focused on their stiffness. So if they were limited in extension, they got the extension manip, but the other half wasn't matched. So if they were limited in extension, they said, well, we'll give you the flexion method. So nice thing is both groups, whether it was flexion or extension manipulations, had improved pain, disability, and function following the manipulation. So if you're more familiar with one versus the other, or your patient can't tolerate laying supine versus prone, you have different options. So go ahead and put your arms across your chest. Gotta make sure we lock in the shoulders and elbows. Bend this. I like to use a small towel to place in between my hand to prevent hyperflexion of my knuckles. Kind of roll over. Again, find that stiffest segment. Wind up the tissue. Make sure that the spinous process is sitting between your thenar and your fingers. Help the patient roll back on over it. Get your chest up and over. Lift your head. And kind of play with those segments a little bit to see how much you can flex them. So right before you come off your fingers, take a deep breath in, breathe out, sink in, and thrust using your body weight. Now, if we wanted to treat the cervical spine for mobility deficits, go ahead and lie on your stomach. There's an article that looked at 2-week treatments, so 4 sessions over 2 weeks. They compared cervical mobilization versus cervical manipulation. And with the mobilization, they performed PAs, so posterior and anterior mobilizations, at the stiffest segment that the therapist found. Oscillations for 30 to 40 seconds. They performed 4 rounds of that. And again, 4 sessions over 2 weeks. And then the other group got cervical manipulations. The nice thing was both groups had improved pain, function, and disability. So if you are more comfortable with the mobilization versus manipulation, or you're worried about the safety issues that come along with cervical manipulation, cervical mobilizations have benefits as well. Just remember, when we're doing mobilizations to the neck, you don't need a lot of force, right? It can be painful for anybody even without neck pain if you push in there too hard. So make sure you take up some of the tissue slack and keep your elbows extended so it just comes like gentle through your body weight. And you can adjust the different grades, grade 3 or grade 4, based on your desired outcome and the patient's irritability. So when it comes to therapeutic exercise or home exercise program for the mobility deficit, come up to sitting. We'll go over a couple different options. There's no article that looks at just one specific TheraX. A lot of them kind of are, they include multiple different ones, but there's articles that have benefit from home exercise programs and TheraX for cervical range, and we'll go over some of the options they use. All right, so one option is just having the patient actively do cervical rotation and using the contralateral side overpress to the chin and cheek. Okay? We don't really want them to yank on their head because it causes more of a torque in the side bend, so just rotation. And we like using the opposite hand because then it keeps these muscles relaxed. Right? This is the side we're rotating towards. Right? You kind of keep these muscles relaxed. If the pain is on this side and we're improving rotation, we could always use this hand, so that way you have decreased activation of those muscles. Another option they used was self-mobilization, so kind of using 2 fingers, 3 fingers, either one. You kind of find the segment that you were mobilizing perhaps, and have them pull, doing the same kind of posterior to anterior directed force while they rotate. And then lastly, the towel snag. So using a pillowcase or a small towel, have them place that behind their neck. Try to get it to line up with the segment you were mobilizing that you found most stiff. Have them cross their hands. So for this direction, she's going to work on left rotation. This one holds strong. And as she turns left, she's pulling, creating a mobilization at the cervical spine. And then if she was going to go to the right, she would switch hands. Good. Multiple repetitions to improve that mobility or maintain the mobility they gained in the clinic. And importantly, after these treatments, what are we trying to recheck? Recheck range of motion, because that was the prognosis-related impairment we found, as well as it kind of gives us an idea if we're on the right track. All right, I hope you guys enjoyed today's Mentoring Minute, and stay tuned for later this week as we talk about patient education related to mobility deficits as well. Take care.